Good afternoon and welcome to our weekly press conference that's hosted by our mayor and several other people in our community who are interested in making sure you have the right information on what's going on. We're originating this again from the third floor conference room of Waco City Hall. Downstairs in our TV studio we have an American Sign Language interpreter that's doing a sign language interpretation for those people. And we also have a full Spanish translation being recorded that will be replayed this afternoon at 4:30. Normally, we are thankful to have Hector Sabito, our council member for District 2, to come and introduce to our Spanish audience and invite them to watch that. But instead, we have Senator Camarella from our City Secretary's office who is going to read a statement inviting our Spanish speakers to watch this afternoon at 4:30. Senator?
Buenas tardes. El miembro del concilio, Héctor Sabido, no pudo estar esta tarde, pero como siempre, el audio completo en español de la conferencia de prensa de hoy está siendo grabada y estará en vivo a las 4:30 de esta tarde. Gracias.
Thank you so much. Well, as we've been doing in the past, we're doing this all virtually, but we're also in our conference room, even though we are further than 6 feet away for the 4 or 5 people that are here, we're wearing a mask, so we want to set the good example on that. Joining me today for our press conference is our mayor, Waco Mayor Kyle Deaver. Also, Dr. Jerry Mays, who's CEO of Education Service Center Region 12. Dr. Jackson Griggs, who's CEO of the Family Health Center. Dr. Mark Allison with Baylor Scott and White Medical Center. And Dr. Brian Becker, who is with the who's the Chief Medical Officer with Ascension Providence. Gentlemen, always thank you all for being here. And Dr. Elison, I hope I'm getting that correct, and close enough to welcome you, Dr. Judge Felton had a prior commitment. He was not able to be with us today. Let me outline real quickly what we'll do. We're going to ask each one of you to make an opening comment, whatever's on your mind and heart, what you've heard throughout the community. Then we'll open it, and I'll read the questions that we've gathered throughout the week from various people, media, and throughout the community. And then following that, we'll open it up we have 2 media representatives on the phone through the Zoom meeting, and we'll let them ask 2 questions each. And then we'll close with closing comments. So let's open up. Let's get going right now. And we'll start off with our opening comments and start with Dr. Jackson Griggs with the Family Medical Center.
Great. Thank you, Larry. And thank you, Mayor and others for inviting me back. Worldwide, we're approaching 26 million cases of the novel coronavirus and over 860,000 deaths worldwide. The United States, we've seen 6 million cases and 185,000 deaths. In Texas, we've seen 617,000 cases and 12,681 fatalities. I'll share some additional state data in just a moment. The Mclennan County update as of this afternoon, our total number of confirmed cases is 6,549, 1,969 of which are currently active. As of this afternoon, the Public Health District has received notification of 95 new cases of coronavirus. 36 people are currently hospitalized with COVID-19. 16 of those patients hospitalized with COVID-19 are currently receiving ventilator support. There's been 1 additional death in our community, bringing the total to 88 deaths as of this afternoon. Total tests completed in Mclennan County, 54,436, and 86% of those have been performed on Mclennan County residents. Within elder care facilities in Mclennan County, currently there are 9 ongoing facility outbreaks. Again, that's defined as 1 or more resident having the coronavirus. There have been a total of 480 nursing home associated cases and 38 deaths. At the county jail, there are 16 total active cases among staff and inmates. There have been no new church clusters within Mclennan County that have come to the attention of the health district. And we have 24 active cases associated with schools in our county. I'm going to try to share some slides here with you that I felt like might be helpful. Last week I described incidents as rolling new cases, average new cases per day per 100,000 in population. And so over here on the y-axis, on the left side, you can see the number. These are number of new cases per 100,000 in population. And this bar graph represents cases in Texas starting June 1st through August 30th. And if I were to overlay McLennan County cases, again, this is per 100,000 in population. What you see is here, late June to the beginning of August, the incidence in McLennan County exceeded that in the state of Texas. Only recently, in the last maybe just over a week, have we begun to exceed the number of cases in Texas, new cases per 100,000. The reason this is valuable is because it allows us to kind of compare apples to apples. You know, if we're looking at large populations, incidents in large populations, if we're just looking at raw numbers, a big population is likely to have a big number of new cases. But we're really interested in comparing proportionally between populations. So the Harvard Global Health Institute has helped to create thresholds for populations, and because we're looking at proportional numbers, general populations can follow the same thresholds. Now, saying that, this is one organization's set of thresholds and is not necessarily, this isn't perfect science here. And so while we're looking at these numbers as general guidance, there is a way to, I think, over-interpret these numbers as sort of gospel truth instead of tailoring these and thinking about these as they relate to our community. So the Harvard Global Health Institute suggests that if you have more than 25 cases per 100,000 in your community, you're at a tipping point where you're going to see rapid growth in cases, that exponential growth that we saw before. When you're in that space between 10 and 24 cases, you're in an accelerated spread period of time. When you're between 1 and 9 cases, you have community spread, and less than 1 new case per day on rolling average, you're on track for containment. So again, these strata just help us to think about our own numbers as they relate to one group's recommendations. If we were to look at positivity rates, now we're looking at the y-axis on the right side of the chart here. I'm going to superimpose our positivity rates on top of our incidence, and then remove our incidence, our new cases, so we can just look at positivity rates for a moment. What we see is during that same period of high incidence, we saw also that our positivity rates exceeded that of the state. And only recently have they begun to exceed that of the state of Texas again. Harvard Global Health Institute also points to the positivity rate threshold of 10% being an important threshold. Less than 10% positivity rate, mitigation is more achievable. And mitigation, they describe as some reduction in the reproduction number of the virus. That's the RT through diagnostic testing and contact tracing. So that threshold is important. They also point out that you really have to get the positivity rate less than 3% if your aim is to get near 0 case incidence. So if your goal is to get into that containment area, that less than 1 new case on rolling average per 100,000, you really have to be doing ample testing to get your positivity rate less than 3%. So just a kind of a synopsis of where we are, and if we're looking at where we are through Harvard Global Health Institute's lens, it'd be important to note that McLennan County is not adequately testing to achieve mitigation. It's in the accelerated spread phase, but has not yet reached that tipping point. I've been presenting the RT on a consistent basis. So right now, the RT for Texas is 0.89, and the RT for McLennan County is 1.07. And that's, again, from the UT School of Public Health. That's all that I have.
Okay. All right, Dr. Brian Becker from Ascension Providence.
Hey, thank you, Larry. Good afternoon. Once again, I'd like to thank Mayor Deaver and this response team for affording me the opportunity to participate in today's session. I think it's important to recognize that I represent Ascension Providence, Ascension, Texas, in this conference, and I provide a bit of a snapshot into what's going on in one of the healthcare facilities in our community. I appreciate that our positivity rate across the county and community has shown a bit of an uptick. We have seen somewhat of a decline in hospitalized patients in our facility. So this past week's average compared to the prior week, we're down about 20% on hospitalized patients. We've seen less ICU patients. So from a standpoint of what we're actually seeing and taking care of in our hospital, there seems to be a bit of a decline. Oftentimes, what we see in the hospital lags a week or two from what we're seeing from testing. So I think it's important for us to keep an eye on what happens over the next week or two. It's important as we look forward to a long holiday weekend that we remain cognizant of social distancing, wearing masks, and try to avoid large social gatherings if possible. So I think that's important moving into Labor Day weekend. If you're traveling, be aware of where you're traveling to, what's that rate in that community, what are you potentially at risk for in that community. So I think it's important to keep that in mind. And then lastly, I've said several times, as is everyone on this panel, really important as we're moving into fall to remember flu shots, get your flu vaccine. I think that's critical for folks in our community to keep that front of mind. Thank you.
Thank you. Dr. Mark Eliason from Baylor Scott and White.
Thank you. Yes, also representing one of the hospitals in our community, Hillcrest, Baylor Scott and White, and honored to be here, and thank you for including us and allowing us to participate and answer some questions. Similar to Providence, we've also seen a downtick in our inpatient COVID hospitalizations. So, and as Dr. Becker said, we do see a lag. Most patients are going to be diagnosed and then they're going to not present to the hospital or be sick enough to be hospitalized for several days and sometimes up to 2 weeks after that initial diagnosis or onset of symptoms. So while numbers are ticking up a little bit, hospital stays are down for us this past week, also about 20%. But then also we might be seeing that tick back up in the next week or so. So we're vigilant, but we've also had some great successes and some miraculous recoveries, but unfortunately we've also seen some patients succumb to the illness. Great words of wisdom have already been said. I'll just repeat a couple of those. Just because numbers are perhaps improving a little bit, we shouldn't let down our guard, but we need to continue to wear masks and avoid large gatherings and use appropriate hand hygiene and not share our germs. Thank you.
Thank you. Dr. Jerry Mays with the Education Service Center, Region 12. Are you on mute? I don't hear.
I was, yes. I apologize for that. Thank you, Mayor, and thank you, Larry. And thank you for having us on. Region 12 provides the education services and technical support and training for the McLennan County schools, but for schools in the 12 county area. So we're interacting with about 85 different public schools and charters and private schools regarding issues surrounding COVID. And education is the fabric of our society, and no one wants to get back to school more than educators and frankly more than children. What we're seeing is a lot of happy kiddos about getting to get back and be with their friends and in that school environment. And while that's so important, it's also so difficult because education by its nature is just a large group activity. But every single school that we're working with has worked meticulously to create small groups, to create distancing, to increase sanitation and disinfectant of classrooms and use spaces and traffic flow among teachers and students, and every conceivable detail is being worked on, because the one thing we know about the virus, and my medical community friends continue to make this very clear to us. The one thing that we know is when we get people back together in large groups, the number of cases go up. So how to manage that? I'm here to say, though, that your school districts have done and continue to do an excellent job of doing everything that the CDC and state guidance has given us, and that the medical community has given us about what to expect from this virus and how to best keep it contained. So again, thank you for making us part of this discussion, and I'll be happy to answer any questions.
Thank you. Waco Mayor Kyle Deaver. Mayor?
Thank you, Larry. Thank you all for joining us again today. I want to especially thank our panelists, Dr. Griggs, who is here so often and always brings great insight. And Dr. Griggs, thanks for that additional information regarding the Harvard recommendations. I think that gives us a great data point to work from, along with many others that we've seen. But that's the first time I've seen that particular information, and it's very helpful. Dr. Mays, appreciate you being here representing the Region 12 and the public schools, and Dr. Becker and Dr. Eliason, appreciate you all both being here representing the hospitals and our healthcare networks. Last week, we talked about some of the progress we had made as a community in getting the spread of coronavirus in our community back under control. We also discussed the challenges that were before us. Among those challenges, school reopenings for in-person learning, college students returning to Waco, churches gathering for more in-person worship, and bars being allowed to reopen under food and beverage permits. All of those things are happening, and we are starting to see a rise in our daily new cases and our positivity rate. Let's take a look at the data. See if I can get my screen to share. There we go. So this week, our total cumulative number of confirmed cases in Mclennan County passed 6,000. We're now at 6,454. Probably the more important information is the new cases each day. The blue bars represent the daily numbers, and then the red line shows the 7-day rolling average. We had gotten down to an average of about 50 new cases per day a couple of weeks ago. We're back up to between 75 and 80 per day. We do believe that a substantial number of those cases are Baylor students. Baylor is reporting on their dashboard a 7-day average of 55 new cases per day. The health district is working with Baylor to be sure that all of the confirmed cases at Baylor of students who are currently in Waco and Mclennan County are being reported to the health district. They have numerous labs that they're working with, and it's possible that there could be some revision of these numbers as these details are worked out. We're working diligently to get that resolved, be sure we're as accurate as possible. As was discussed by both Dr. Eliason and Dr. Becker, our hospitalizations are finally coming down. We were at a high of about 80 back in mid-July and are down there near 30 now. Again, and actually our patients on ventilators, which is the red line, is starting to come down too. But as a proportion of total patients, it's still a pretty high number. And so we still have several pretty sick people in our hospitals. The Texas positivity rate, rolling 7-day average since June 1st, it is trending down. It is at now at about 12%, and hopefully it will continue to decline. Texas as a whole faces some slightly different things than we do here in Waco, but they also have some of the very similar challenges. And so it will be very interesting to see whether we can continue that downward trend in the state. Hopefully we can do that. For Mclennan County, we had gotten our positivity rate down below 10% a couple of weeks ago. Now we're back at 15%, which is not a good number. And so that is very concerning. And we're going to have to continue to be vigilant in order to bring that number back down to where we would like to see it, which is at 5% or below. And then this is deaths per week. Our deaths per week continue to decline. We had 4 deaths this past week compared to 7 the week before that, and 8 the week before that, and then 16 at our peak. Every single one of these deaths obviously is an individual who is cared for, and they're all tragedies. So I don't want to diminish a death just because we only had 4 this week. We certainly want to see that number continue to decline. For context, we had only had 4 deaths up until June 14th, and we've had 83 deaths since that time. So that is a lot of people in our community who have died from this. And what we want to do is get those numbers back down, because we know that hospitalizations lag new cases and deaths then lag behind hospitalizations. If we can keep these new cases down until we have a vaccine and better treatments for COVID-19, we can save lives, and that's what this is all about. I will stop there, and we will turn it over to Larry for questions.
All right, let's get going with our questions. Is there any discussion of doing widespread testing at public schools the way Baylor has done, and how helpful would that be in tracking and containing the virus?
Dr. Mays, can you take that, please?
I think the appropriate response is that there just doesn't seem to be, or there hasn't been to this point, scalability of testing in a way that schools could really utilize that. I think everyone, and I believe my medical colleagues here, would say that that would be a good thing. Could it be done? It's not been an active part of the discussion because, frankly, it doesn't appear to be available to us. Dr. Griggs or others, I'll defer to you about whether or not I'm right about that.
I would concur. If school systems could match what Baylor is doing in terms of random testing. Baylor's done a great job, but it's got resources available to it that I don't imagine the public schools could muster. So I think the scale of what Baylor has done, as good as it might be in public schools, might not be feasible. I would also add that among the age group of Baylor students, there's probably more transmissibility of the virus than in particularly younger school-age kids. So it's probably more critical that Baylor is doing this kind of testing on a regular basis than to the community at large than it would be for schools. So it's a great idea, probably not feasible from a cost standpoint. More important that it's being done at university than in younger students.
Okay, how many cases have been connected to K through 12 schools and their student populations in the last week, and which schools are reporting? And following up on that, how many overall?
So Larry, at this point, we believe that all schools and school districts are reporting. Overall, since March, we've had 57 cases. 26 of those have been staff, 31 students. Currently, we have 24 active cases, 9 staff members and 17 students. If you want to see individual breakdowns, you just need to go to your school's website to get that information. Importantly, up till now and through this week, we have been reporting those cases on all students, whether they were virtual or on campus. Going forward, beginning next week, we will only be reporting on students who were on campus at the time they contracted the disease, so that we can better track, so that the health district can better track outbreaks in schools.
Okay. How many cases have we seen among the 3 colleges?
Well, Baylor, as you know, did testing before they brought their students back. So some of the tests that are reported positive for them were students that tested positive and then did not come back to Waco or haven't come yet. So their overall number is 683 cases. They have 478 currently active cases. MCC has had 30 students total since March and currently has 7 active cases among students. And TSTC has told us recently that they have 1 active case. I believe they've had less than 5 active cases among students since the beginning of this.
Okay. How successful do you think local high schools have been at mitigating risk at football games so far? And what additional protections would you like to see as we prepare for more games this week?
I think this is going to be an ongoing, evolving situation. I know that UIL just released new guidance this week. Jerry, can you speak to that a little bit?
Looking to UIL for guidance, that will be evolving. I think the one thing that we know about this is, football games and groups, there will be some cases associated with that. But I can, all I can attest to at this point is that the school districts are going to great lengths to create the distancing and masking and the disinfecting and the kinds of things that we know that we can do. And then this will likely be just a time of responding to the result that we get.
And I guess, like you were just talking about earlier, is comparing Baylor's testing to what the public schools can do. The public schools are not in a position, I don't believe, correct me if I'm wrong, to test their athletes before games like the universities are. Is that correct?
That is typically correct, yes. I'm not aware of any situations where it's available in a matter of process. Public school expectations and frankly legal requirements for doing that kind of testing are a little more complex. But beyond that, most importantly, just the availability of testing to schools. It just hasn't been there so far.
Okay, thank you. Anything from any of the doctors on that? All right, thank you. All right, thank you, Larry. Please go ahead.
The CDC recently updated its COVID-19 cause of death data to include causes of death besides COVID-19, leading some to claim that the real death toll is much lower. What does the cause of death data actually mean?
Dr. Griggs, could you speak to that, please?
Yes, of course. So I think this recent controversy highlights our susceptibility to believe good news over true news. It's really hard, I think, to face the actual numbers of cases and deaths day in and day out in a pandemic. So when a fringe group purports that the CDC has way overestimated deaths due to COVID-19, it's tempting to get on that train. To clarify what happened, the National Center for Health Statistics, which is run by the CDC, posted a usual update last week. The number of deaths attributed to COVID-19 in that report were by and large consistent with the Hopkins numbers that I report each week and that are widely noted through scientific literature and the general press. So in the CDC's report, in the section under comorbidities, there was a note pertaining to the total number of COVID-19 deaths to date. It said, quote, for 6% of the deaths, COVID-19 was the only cause mentioned. In other words, there were no comorbidities like heart, lung, liver, kidney disease, obesity, also mentioned on the death certificate in those 6% of those who died from COVID-19. So this fact is entirely consistent with what we've known about the disease. It's not new information. But some individuals misread this 6%, thought it meant that only 6% of the reported numbers of deaths due to COVID-19, only 6% of the previously reported numbers were actually due to COVID-19. And then they posted this on their Facebook. A fringe political group picked it up, amplified the message, and then a lot of people fell victim to this misinformation. I think the larger point then is just that the public should be careful listening to highly partisan voices for health data. I think right now, as we're looking ahead to November elections, we have to be very, very careful from whom we're receiving our health data. Scientific literature can be difficult to read, and non-scientific readers with strong biases can unfortunately create myths for various emotional reasons or to reinforce certain beliefs about the world.
Okay, what is the potential impact of COVID-19?
Larry, could I add just an extra comment
Absolutely,
there?
no, please do.
You bet. Thanks for letting me interrupt. So with any cause of death, it's always difficult for a physician to label it just one thing. And I signed 3 death certificates this morning, and with each one, I try to get it right. And, there's never, or I shouldn't say never, there's often other competing factors. And so labeling just one disease process as the ultimate cause of death is always a bit of a challenge for me. Sometimes it's pretty easy, but whether it's COVID or a non-COVID illness that leads to a death, there are contributions from other diseases and other processes. And sometimes labeling one over the other is really the ultimate challenge. And I think whether we're talking about deaths or we're talking about just the illness itself, I think as a community and as a nation and maybe as a world, we're putting too much emphasis on the death as well. I overheard 2 strangers having a conversation yesterday And one of them was commenting that it had only killed 0.001% of the American population. And I really wanted to interrupt, but I didn't. But I guess I get my moment here to say something and retort. It's not just the death that I'm worried about. As a practicing physician, I've seen this maim people who are young, people who have little comorbid conditions, who are left permanently disabled from a stroke at age 44 or from severe lung disease that is going to leave them potentially crippled for the rest of their life. So it's not just the death, but the disease can harm people in other ways that's just as serious and just as concerning to me. That's all I want to say. Thanks.
Well, thanks so much for interrupting me and adding that, because that was very, very, very good information. What is the potential impact of COVID-19 on pregnant women and their babies? Is breastfeeding recommended for mothers who have COVID-19 or have had it?
Dr. Griggs, can you speak to that question?
Yes. So the CDC since January has reported 4,624 hospitalizations among pregnant women with COVID-19. 197 women who were pregnant needed ICU care, and 71 needed mechanical ventilation. And I'm going to give you a quote from the CDC. This is a recent report. That quote is, pregnant women with COVID-19 are more likely to be hospitalized and are at increased risk for intensive care unit admission and receipt of mechanical ventilation than non-pregnant women. The risk of death is similar for both groups, but much remains unknown. And then end quote. There have been 19,235 reported cases among pregnant women, but only 41 deaths. So about 1 in 500 is the case fatality rate among pregnant women who test positive for coronavirus. In mid-August, so really a couple weeks ago or so, the American College of Obstetrics and Gynecology, they updated their general information about COVID-19 and included a statement, again, quote, although there are cases of reported vertical transmission, and that, by the way, is transmission of a mother to the fetus, although there are cases of reported vertical transmission of SARS-CoV-2, the data are reassuring that vertical transmission appears to be uncommon, end quote. So moms passing it to their fetus that then is born, that doesn't seem to occur with any regularity based on the limited science that we have to date. Answering the question about breastfeeding, again, the CDC offered a kind of candid comment, which is that they don't know whether mothers with COVID-19 can transmit via breast milk. There is limited data that suggests that this is not a source of transmission, but breastfeeding is very valuable, and so that benefit, knowing that benefit is there, it's hard to sort of make that benefit risk calculation, and should be done between a mother who's expecting and her healthcare providers. Obviously, there may be factors pertaining to the newborn that would make it more beneficial to breastfeed, and there might be factors if a mother has COVID-19 that would make it too risky. So it needs to be, that conversation needs to occur with a mother and her healthcare providers.
Okay. There's a couple of questions that I'm going to combine. How can parents and communities support schools, and how is the Education Service Center Region 12 supporting schools?
Dr. Mays?
Yes, thank you, Larry. We've had the opportunity, excuse me, and part of our work is to work with schools on developing plans, adjusting calendars, making recommendations. But the good news is that, every school district has a locally elected board, and they hire a superintendent. They understand the nature of their community, what the needs of their community are. And basically what we do at Region 12 is provide support for whatever they need to get that into place. one thing that we do that is across the region, which is the 12 county area, including Mclennan County, is just try to get a consistent message out there of state and CDC guidance, make recommendations based on what we know on conversations such as this one. What's the local health community saying to us about virus and spread? And we're finding that schools are doing a really nice job of getting those things in place. I think one thing that needs to be said, and it's obvious, but it needs to be said, schools are a subset of the community where they exist, right? So what's going on in the community tends to show up in the school. There's a real important interface there regarding quarantine, for example. I think there's some misunderstanding about what that means necessarily. Children and parents are kind of perceiving, if they're in a quarantine situation, that means it's almost like it's just a school thing. When in reality, quarantine means I just plain need to stay home. I don't need to go to my other activities, don't need to play ball today, those kinds of things. So just getting some of that messaging and understanding out there, which is an ongoing, it's an ongoing part of the discussion. It's important, but I think that is the most important way that the school and the communities, the way the communities can work with the school to help, because as community spread goes down, it will become much easier to have school in a way that looks a lot more normal to students and parents and educators.
Well, Dr. Mays, you just mentioned quarantine. Let's ask the medical. Can you define the word quarantine if parents get notices and kids are asked to quarantine?
Dr. Griggs, are you where you can answer that one?
Sure, I'm happy to. So quarantine is the isolation of someone who is not known to have an infection or a disease, but who may have that infection or disease away from others. So keeping an individual who doesn't know they're infected but may be infected away from others. And practically what that looks like right now in the coronavirus pandemic is that if you're on quarantine, you really need to be at home, like Dr. Mays said, without guests or visitors, keeping yourself away from if there are any household members that are not under quarantine and you're under quarantine, it's keeping isolation from that group. Now we're talking about young children who are in quarantine. It would mean that parents and children would both need to be quarantined together. So if you're a parent taking care of a child who is in quarantine, it's probably prudent for that parent to consider themselves temporarily in quarantine with that child, because there's such intimate contact. Now, the CDC is virtually universally saying that quarantine needs to last 14 days from the time of close contact. And so that means that there's going to be 2 weeks of time at home without going out to the grocery store or attending events. And that's clearly, it's difficult on families, but this is a time when we really need to rely on each other. Have someone drop off groceries if you need someone to drop off groceries. Have folks run errands for you so that you can stay at home and not go out and potentially expose others to an infection that you may have and not know it. It's really important to remember that the coronavirus has a pre-symptomatic phase, and in lots of individuals, there's never symptoms that ever show up. And so that's why it's so important to respect the quarantine when a school or health official indicates that you need to be in quarantine.
Okay, at what point would you consider it safe to come out, return to normal, and remove the masks?
Dr. Eliason, would you be willing to answer that one?
Gladly. Yes, I think if we go back to that slide that Dr. Griggs showed us at the beginning, where if we're experiencing low case counts, 0 to 1 per 100,000, then we're in a self-containment phase. And that would certainly ease my mind. And I think also if we have a vaccine and we have a large portion of the population vaccinated or who have contracted the illness and are recovered, then I feel quite confident that we can go back to normal. But that's going to be a long ways away.
Okay,
And our numbers today,
go ahead.
yeah, and our numbers today aren't there yet.
Good. Last Thursday, Abbott Labs got emergency approval from the U.S. Food and Drug Administration for its rapid antigen test, which can detect COVID-19 infection in 15 minutes. What can you tell us about this new test, and will it be available in Waco?
I'll ask each of the doctors, if you would, to talk to us about when it might be available at your health care network. Dr. Griggs, can you talk to us just a little bit about the test itself?
Sure. It's the Abbott Binax Now. It's an antigen test that is very, very similar to actually the antigen test that the Family Health Center has been using for 9 weeks. The potential benefit of the Abbott test is the cost, and maybe it's a little easier to use technically, but in terms of the characteristics of the test, it doesn't have any clear advantage over the antigen test that we've been using for now for several weeks.
Dr. Elias and Dr. Becker, when do you expect to have those, or do you expect to have those in your?
Yeah, we don't expect to have that test at our facility. There are several tests that are available currently that we are using. And some of them are very quick. Some of them are 30 minutes. Some of them are 45 minutes, and some of them are 3 hours turnaround time. This one is 15 minutes, but we do have the machine that this test runs on. So Abbott makes several different tests that can be run on this one particular machine. We are running some of the other tests, but we just have not been able to get the sensitivity up where we feel comfortable using just that test. So it's missing about 1 in 5 positive cases, whereas some of the other tests are more sensitive and are going to pick up those cases. And so we're leaning more towards your tests, and we're not planning to bring this one online.
So, and I would say our Ascension National team is vetting this test, and for the very reasons that Dr. Lawson just spoke to. So they clearly reported what their sensitivity and specificity were in regards to the testing they did for their emergency use. I think it's important for us to do the legwork, much like Dr. Lawson and his team have done. We at this point don't have a timeline for getting this test, if we will. I think it's important to note that 150 million of these tests have been guaranteed to our government, and from there will be delivered to different governors to decide where those tests will be distributed. So, and that's not supposed to take place until mid-September. So even on that timeline, the first batch is coming out will be pretty limited to us as individuals or to our respective companies. So I think it's further down the pipeline. It's certainly it's a nasal swab as opposed to a nasopharyngeal swab, so it's a little bit easier test, a little less technically difficult perhaps, and it's worth looking at. But at this point, we don't have plans to put it into use.
Okay. With a few exceptions, school has started throughout Mclennan County. We've already heard of students in some schools being quarantined for several weeks after contracting the coronavirus at school. From the information we've received, what needs to change within the schools to prevent increased outbreaks?
Dr. Mays, can you speak to the precautions that have been taken?
Be happy to, Mayor. As I mentioned earlier, the schools have meticulously over the last few months worked on guidance from the CDC and the state of Texas through TEA to implement everything that we know that can be a mitigating factor for students in the school and for the staff that teaches them and the people that run the schools regarding distance, disinfecting, masks, shields, small groups, having students stay in a very small group during the day, having alternating schedules when it's appropriate. High school students can actually, under the guidance and the way that schools have to function, high schools have the option of running on alternating day schedules or morning and afternoon schedules. So there are lots of very innovative things being done in the schools right now to decrease the opportunity for spread. And as soon as other feasible opportunities become available, I know the schools will implement those. It kind of goes back to what I said earlier, though, about the nature of the community. Every school has its own context and has its own set of resources and space and community needs. And so while it looks a little different in each community and each school, it tends to follow a general trend line of the kinds of things that I just mentioned. Of course, what we know is that when we bring them back to school, after about 2 weeks, we're going to see some increase in cases for the most part. I think that's just to be expected. You bring folks back together and the cases increase. So there will be some response to that to improve everything that can be improved as the medical community helps us understand what would be a best practice for better mitigating that sort of thing. Some of the schools have started off in remote learning concepts, and some parents have elected to keep their students home for safety reasons and participate in a remote curricular activity, and others are sending them to school. And then there's some blend of that, again, depending on the community and the decisions of that local school board and superintendent and what that community feels like they need. So I guess that's a long way of going about answering your question, but it gets back to the point that I believe every community is doing every single thing that we know of at this point, Larry.
Okay. Well, let's let this be our last question. In Monday's Tribune Herald, over 400 Baylor students have tested positive since arriving on campus. Are their numbers being included in Mclennan County's daily counts?
Larry, I mentioned in my opening remarks, Baylor and the health district are working very closely to be sure that those numbers are correctly reported. Baylor has multiple labs that they have used, and we're trying to be sure that all of those are in our numbers when they are students that are on campus. Obviously, when Baylor tested about 20,000 people, including students and faculty, before they returned to school, those students were spread out all over the nation and even outside the nation. And so those results should have gone to the place where they were, the county where they were residing at the time they took the test. There may be a little bit more that we need to do to get these numbers exactly right. We're working hard to be sure we get them right.
Okay. Let's go now to our media questions. We do have two media representatives on our Zoom meeting today. We have Rhiannon Sagert from the Waco Tribune Herald, and we have Drake Lawson from KWGX News 10. Let's start off with Rhiannon. Are you on the call, Rhiannon?
Yeah. My first question is, how many cases have been reported among high school athletes, and how much spread do we think is being caused by people?
Can you restate that? We're having a little hard trouble hearing you. Can you speak a little louder?
Okay. My first question is, how many cases have been reported among high school athletes, and how many do we think acquired it while playing high school athletics? Any better?
Rihanna, go ahead, Rick. I'm sorry. Was there more to the question than that?
I think that was all of the question. Yeah.
Okay. I don't believe we are tracking at the health district high school athletes and where they may have acquired that. I don't know whether the school districts are tracking that separately. That obviously would be a good piece of information to have, but I'm pretty certain that the health district is not tracking that and probably doesn't have the bandwidth to track that. Dr. Griggs, do you have any different information?
Unfortunately, no. I don't have any information about that.
We'll try to find out if there's anything more there, Rhiannon, that we can tell you about that.
Okay, let's go to Drake Lawson with KWGX News 10. Drake, are you on the line?
Yes, I am. Can you guys hear me okay?
Yes,
Can.
Okay, perfect. Want to just ask, I know it's something that we've talked about many times just in this press conference about Baylor students returning. And you mentioned it, Mayor Deaver, that, quite a few students had tested positive before they got here. However, you also mentioned that a large majority of the new tests, the 75 to 80 positive cases we're seeing a day, are from that age group or from Baylor students themselves. I think it's safe to say there's a little bit of an outbreak going on campus. I mean, it's not super widespread, but there's a significant number going on at Baylor University. Is there any plan that the county has in place to try to contain that, or is it more on Baylor? What's the plan to try to make sure that those cases don't spread into the population of the Waco area?
Well, it's a really good question. For the on-campus students, Baylor has isolation rooms for those that test positive. They have the capability of housing those people on campus and getting them away from the other students. For those that live off campus, they are required to self-isolate in their off-campus housing. I think that's a little bit more concerning, but that's really, I think, the only thing that's practical. We've heard recently recommendations from, I believe, the CDC and others that those students not be sent home, that is potentially more problematic than if they stay where they contracted the disease and self-isolate there. So Baylor is doing everything they can to encourage and to support those kids that are having to self-isolate. I think Baylor is doing what can be done and what should be done. Dr. Griggs or any of the other doctors, do you have anything to add to that?
No, I've been very impressed hearing about Baylor's protocols, and Baylor is a part of our community, and so I think we have to guard against kind of us and them thinking. I mean, we benefit a great deal from Baylor being a part of our community, and right now during the pandemic, I've just seen tremendous work done by Baylor to do all of the right public health steps in order to prevent spread of the disease. I think it's I do think that there's real risk of spillover into the community. I think that that's at some level unavoidable, but at the same time, mitigating that risk is something that Baylor's put a lot of energy into.
I think one other thing that ought to be said is that Baylor is doing its own contact tracing, which is extremely helpful and another really important step towards mitigating that problem. Dr. Eliason, did you have something to add to that?
Yeah, I was just going to echo that. I think that isolating or quarantining in place makes the most sense. That sending somebody off after they've got the illness exposes people in transit as well as their destination. Just staying put, I think, is wise.
Thank you.
Okay. Let's go back to Rhiannon Sagert with the Waco Trib. Rhiannon, you have another question?
Can you hear me now?
Speak up as loud as you can. Did you have another question?
Yes. You've mentioned an inevitable increase of some kind after students return to school, kids I'm talking about. How much would we expect that to be given the positivity rate, the number of cases we have? Can we predict anything?
Would any of the doctors like to hazard a guess at what we can expect?
If we only had the sophistication to predict that based on exactly where we were in the numbers and what we're seeing in the prevalence, I mean, we'd have the Rubik's Cube solved if we knew if we had that kind of an equation that could, or that kind of predictive tool. So I don't know. Maybe Dr. Eliason though.
No, I wouldn't dare venture a guess. But I think if after maybe 1 or 2 more weeks of data and seeing what kind of cases we have with return to school, then I think we can begin to predict. But at this point, we have very little to no data.
Yeah, I think that's, the schools shut down early on. We're just in a completely different situation now with, we were in a very low positivity rate at that point, and I don't think there's a multiplier that you can use. I think it's going to be a wait and see kind of thing, unfortunately.
Okay, Drake Lawson, do you have a final question?
Yeah, I had another question, kind of changing gears a little bit to what Rhiannon's talking about with kids going back to school. I'm pretty sure that many of you are aware of I wouldn't call it an outbreak, but the situation at Midway High School where there was many kids who had to quarantine. There was a couple of positive cases. And the reason why those kids had to quarantine, it went back to, we believe, this big senior breakfast party with a bunch of girls whether they weren't wearing masks, and it was posted on social media, and it was all of those same students who were quarantined. The school district, they said that basically they can't control events that happen off campus, but they're urging parents to try to take this seriously. There's only so much, I guess, school districts can do. Is there something maybe you guys could speak to that as far as this is also on the parents, that this is also on people as individuals to try to take the responsibility and not just kids. I don't know if Dr. Mays maybe wants to take that one.
Dr. Mays, would you like to weigh in on that?
That goes directly to a question that was asked earlier about how the community can help. You know, it is that interaction with the school. The school can do everything the school can do, but what happens in the community shows up in the school. And that can be a very, very positive thing, and it can also create some challenges. And I think what you described is an opportunity where the community, including the parents and those students who are old enough to know the responsibilities and consequences of actions and that sort of thing, everyone works together and makes good choices and good decisions about that. We get better outcomes. So again, it comes back to just that real collaboration and cooperation during what is admittedly a very, very difficult time for parents and students and everyone. And my heart goes out to seniors in schools. It did last spring and it continues to, because many of the cultures and traditions and things that we hope that students get to experience, especially when they're seniors in high school, have not been available in the traditional way. So with an overwhelming amount of sensitivity to how difficult all that is, that's just a classic example of where we have to ask the community, students, parents, everyone to work together to make sure we get good outcomes.
Okay, thank you, Rhiannon and Drake, for being on the press conference today. Let's go into our wrap-up session today, kind of bringing things to a close. We'll start with Dr. Becker, then Dr. Lyson, Dr. Griggs, Dr. Mays, and then Mayor. So I'll start with Dr. Brian Becker from Ascension, Providence.
Hey, Larry, thank you. Thanks again for inviting me to participate, answer questions where appropriate, and to try to make sure that everyone is as informed as possible in this confusing state that we seem to be moving through. I think just some thoughts off the top of my head. Again, I think be cognizant moving into a 3-day holiday weekend of what you choose to do. If you're not well, stay home. If you're out and about, social distancing, wear a mask, hand hygiene. I know we all say that over and over, but it is important for our public health that we do those things. And it's important for our neighbors that we participate in those measures. It helps protect us, but more so than us, it helps protect those around us. So very important for us to be good citizens and practice those habits. I again appreciate the level of collaboration that I see across our community. So whether it's our county or our city officials, or whether it's the healthcare community, we continue to meet and visit weekly and discuss issues that are relevant to this community. And it's through leadership from Mayor Deaver down that really drives that. So it is a real honor to be a part of that. This community is unlike others that I've seen in that respect. So again, enjoy Labor Day weekend, but follow the rules as best as possible.
Okay, Dr. Mark Lyson from Baylor Scott & White.
Yeah, similar comments. So be wise, as has been said. You know, wear your mask when you're out and about. Proper hand hygiene. When you put your mask on, leave it on. Don't fiddle with it. When you take it off, do it with clean hands. When you put it on, use clean hands. Also, so appreciative of the collaboration amongst our community. And it's become a little bit cliche, but we do have healthcare heroes in our community, and they're working hard and tirelessly and valiantly for these patients when they get this illness. Let's just do our best to not be one of those patients. Thank you.
Okay. Dr. Jackson Griggs from the Family Health Center.
Thank you again, Larry and Mayor and everyone involved. I'd just like to drive a couple points home. One is that to address the positivity rate, it means that anyone, even with subtle symptoms, needs to come in and be tested. So testing is so very, very important. If you're not sure whether or not you need to be tested because you have a new symptom, you call your primary care clinician, or come in and be seen. We really want to increase our testing. But right now, in large part, that hinges on the public being aware that the testing is available through primary care and coming in and getting tested when there are symptoms. The second point that I'd like to make is again, the importance of flu vaccination. We really need to keep flu rates down in our community this flu season. For multiple reasons, the health of the individuals who having flu, and then on the tail end of that having COVID-19 or vice versa, could lead to some important debility or even death. There's a lot we don't know about flu and COVID-19 infections in the same individual, but we're concerned about it. So, and then on the healthcare capacity and supply side, it's so important that we keep flu numbers down so that there's capacity in our hospitals for caring for the COVID-19 that we're going to continue to see in hospitals for the foreseeable future. So flu vaccines are imperative. I'd like to make a special point that communities of color have been particularly hard hit by COVID-19, and these same communities have lower vaccination rates historically. I don't know our county data, but nationwide, 49% of white adults received flu vaccines last year, 39% of African American and 37% of Hispanic adults received vaccination according to the CDC. If you're someone who has influence, either by virtue of being a healthcare worker or by being a member of a community of color, please advocate for vaccinations this year in your community. I think that's very, very important. That's all I have to say.
Okay, thank you. Dr. Jerry Mays with Education Service Center, Region 12.
Again, thank you, Larry. What I would say is I just come back to that point we made earlier about just that cooperation of community and school. And that's just so important. Nothing much good comes of this without that kind of cooperation, because at a time when everyone understands how difficult it is for students to be out of school, to be receiving home instruction, for school to be disrupted from any traditional sense in the way that we understand it, we're asking people to accept a great amount of change, but for the greatest possible reason. You ask about Region 12 and what we do earlier. Well, we'll continue to support all of the operational, curricular, training, budgetary, all the things that we do. But at the end of the day, obviously, all of that is calculated to keep the students and staff and teachers on those campuses safe. And as I said earlier, what happens in the community gets reflected in the school. So to the extent that the entire community can buy into everything that's been said today, it's all been very insightful for me. And let's carry that forward. This will be, by any stretch, the most unusual and difficult school year any of us have ever tried to conduct. There will be starts and stops. There will be dealing with quarantine a lot. It's already out there, as we will have schools, depending on where they're located, the community, the amount of that community cooperation, it'll be reflected a great deal in the outcome of this school year. So thank you to the parents and the community members and everyone is working hard on that. Thank you to the people on this panel, our healthcare, our governmental leadership, our educational leadership out in the schools. Phenomenal work and collaboration. Thank you for that. Mayor Deaver, thank you for your leadership and for having me on the panel today.
Okay, and finally, our host, Waco Mayor Kyle Deaver.
Well, thank you, Larry. And as always, thank you and your municipal information team. I want to thank Julie and Cindy from the City Secretary's office, and Kelly Crane from the Waco Mclennan County Family Health District, all the great people that are doing such good work there to try to keep us well and safe. I also want to thank the translators, both the Spanish language translator and the American Sign Language translator, who help us get this message out to as many people as possible so that everyone understands how important the things that we're being asked to do are for our community. And thanks to the media for great questions, both before and during the press conference. Dr. Griggs, thanks again for being here and for the great insight that you always provide. And again, thanks for that information from Harvard today. Dr. Eliason, appreciate you being here for the first time. I hope to see you again. A great addition. And Dr. Becker, we certainly appreciate your time and you being here on behalf of Ascension Providence. And Dr. Mays, thank you again for coming back to talk about what's happening in schools. That is so much on the minds of all the people around our community. And I've got to say that I'm really impressed so far at how well the schools have been doing and how few students we have so far with the coronavirus. And as you've said, and we've talked about before, both for those school students and also for our college students, it is so much more about what's happening off campus than what's happening on campus. The schools are doing a fantastic job of planning and implementing, and we definitely need parents and students to support that work and not blow it by doing things that aren't wise. We know this is hard. It's trying for everyone. It's not the way we want to live our lives right now, but it is the way we can keep our schools open, keep having football games, get our businesses more open. All of those things are completely dependent on us following the rules and keeping our distance, wearing our masks, and keeping each other safe. I'm excited to announce that we have new free testing coming up. Our Emergency Operations Center, teaming up with the Waco Mclennan County Health District and the Texas Department of Emergency Management, are bringing more free testing to Waco. We will have testing September 16th and 17th at Tolliver Chapel Missionary Baptist Church, 1402 Elm. That will be a drive-up testing. Then September 24th through 26th, which will include a Saturday, we'll have testing at a walk-up site, which will be the Waco Multipurpose Facility, 1020 Elm. October 2nd, we will have more drive-through testing at the Waco Fire Station number 5. That's our newest fire station over on Bagby. Again, that will be a drive-through site. This testing is free. You do not have to have symptoms to be tested, and it is the cheek swab, so it is not the invasive nasal swab. So if you have any inclination that you may be have been exposed or have symptoms, please come and be tested at those. All of that information is on the covidwaco.com website, and that and so many other resources are there. We've got Labor Day weekend coming up. We've got high school football games. We've got Baylor football games starting soon. All these things are great. We just need to do them smartly and safely. These are the things that we look forward to, and we should be able to enjoy them with those that live in our households and safely distanced from everybody else. So I just implore you to do that so we can continue to drive down the rate of spread in our community. As Dr. Griggs said, our RT is currently 1.07 in Mclennan County, and anything above 1 means that we are expanding the disease rather than contracting it. This is either the first or second week in a long time that we've been above 1. So we've got to do our part to get this thing back down. So continue to stay at home when you can, limit the size of your gatherings, and keep your physical distance, wear a mask. If we do those things, we're going to continue to get through this. I ask that you would continue to pray for our healthcare workers, our first responders, and all who have been affected and are continue to be affected by COVID-19. Take care of yourselves and take care of each other. We are continuing to get through this together. Thank you.
Thank you, Mayor, and all of those on the panel. I want to thank you for that. One other little note while I've got the opportunity, the Waco Mclennan County Public Health District is now providing birth certificates for out of the county people who have requested them. The state had a problem this past week, and just today we've announced the fact that we are now able to help facilitate getting those birth certificates. Busy time of the year for the birth certificates, but you can call and get an appointment, but the health district will be able to help you with that now. I want to thank all of you all for being with us again. Like all of our panelists have said, we hope you have a safe and very safe Labor Day weekend. And thanks for joining us, and we hope to have you back next week because we'll be doing another one of these this time. And have a good afternoon.